Good morning. This is Dr. Ellenburg. We're here today to talk about the Weber laser helmet. We've been using this in our practice since it came out last November. The use of transcranial, and the new fancy words these days are called transcranial photobiomodulation, is not new to the world of laser therapy. Laser points have been studied on the brain with acupuncture points for many, many years. So the science of treating the brain with lasers is not new, but what is new with the use of this technology is we have the ability, there's 320 diodes in there, we have the ability to treat large areas of the brain, where before with just treating acupuncture points it was more difficult to treat a large area. So this type of science and this development has really made a huge difference in how we can treat and try and nourish the entire brain with therapy. Again, a good search term to be using if you're going to use the National Library of Medicine's website, which is pubmed.gov, so pubmed.gov, and you could put in the word transcranial photobiomodulation. You'll find some of the most recent articles on there, and there's well over, I think, 30 or 40 now on there. And again, laser acupuncture has been looking at this much longer than just using that search term. So if you were to look up laser acupuncture, you'll find some more information as well online to look at what's going on. The hard part, I think, for a lot of clinicians to realize is that this clearly can penetrate the brain. And that comes down to the fact that their Weber is using a very specific type of infrared laser, which is 810 nanometers. The whole helmet puts out 16 watts, but can be adjusted at a 25%, 50%, and even 75% of that power. So you can decrease it or increase it as needed with patients. We've been using it in a lot of patients who have had concussions, primarily. We do have some patients we've been using it who have had strokes more recently, and we tend to use these often in combination for those type of patients, be they TBIs, so traumatic brain injuries, or with stroke patients with the use of hyperbaric oxygen therapy, where the patient is getting that treatment first, and then once they come out of that, then we then have them use the helmet for anywhere from 30 minutes to 45 minutes after the treatment. And what's interesting, of course, about hyperbaric oxygen therapy is that you can increase the oxygenation of the tissues, and that's going to enhance photon energy being absorbed, so it makes the blood more photosensitive. Now, on its own, how is this actually working? Well, we do know from the studies that have been done, looking at the variety of mechanisms that are being used, is one, we know there's an increase in oxygenation in the brain. There's an improvement in blood flow. There's also an improvement in what's called neurogenesis, which means it allows the ability for your brain to create new brain cells. And a lot of this is taking place due to the fact that infrared energy can be absorbed at the mitochondrial level. And if you may remember or not, but the brain has a second highest amount of mitochondria anywhere else in the body, with the heart being first. So it's a great way to stimulate these cells at a deeper level in the brain. And we get about 4 centimeters of penetration with the infrared light. Red lasers only go to the scalp, and then green, yellow, and blue do not appreciably go very far into the brain, and therefore we don't use those typically topically to treat anything with the brain. Besides treating TBIs and treating post-stroke patients, we're also using this with dementia, mild and moderate dementia, and we're also using it with depression and anxiety. And I always like to make a little point that we want to make sure that in those patients as well, we want to make sure that we're evaluating them fully and not just focus on using the helmet, of course. So if someone comes in who has depression, but it's up here in Alaska, we want to make sure they got good vitamin D levels. They don't have low thyroid function. So we want to make sure we address any underlying causes that we can address, and then add this in as a good measure to help treat the brain directly. Many patients here are also doing other therapies, particularly with Weber. We do, of course, use the Weber IV laser just about every day that we're here in practice with patients, and often we have them using the helmet during the treatment to kind of enhance their treatment experience and have a chance to try out this technology. We also have patients that we use it on after ozone therapy with the blood. We use a hyperbaric ozone treatment, a machine from Germany we use, and after the patient has used that treatment, we have them use the helmet afterwards, again, because we know that with that therapy, we're enhancing oxygenation of the blood dramatically, and that makes it more photosensitive to the patient receiving this treatment, and we're even using that along with Weber IV laser as well. What else can we say about this? I use this at least once a week myself just to help support my brain health. It makes me feel better. I mean, the reason I even got involved in looking at the use of this type of science on the brain initially was a few years ago at a mental health conference that actually had a device, it wasn't a Weber device at the time, that was being used to treat depression, anxiety, and PTSD in soldiers back from war in Iraq, with really good data on it. So I got very interested in that and actually bought a device at the time and used it and saw that I actually felt different. And I'm pretty sensitive to things, so I know I'm getting something good for myself, and I was quite impressed. And so that's kind of how my interest in the science began, on the use of the transcranial science, that is. But I really encourage you to check this out. If you get time, if you look up Weber Medical and make sure you put in Germany along with that in a Google search or a DuckDuckGo, we're going to use for your search engine, you'll find them and can read more about the helmet on there as well. And again, on pubmed.gov, pubmed.gov, you can also find out more information. And I should also mention too, which I didn't, is that you can also program in frequencies into this. And so the main frequencies that I've seen in the research that I've reviewed that are used often are 10 hertz and 40 hertz. And 10 is more the alpha wave range in the brain, where the 40 hertz range is more the gamma. And the gamma is kind of picking up on the research, at least what I've reviewed, and being used a lot more often these days than the 10 hertz where they began with. But the Weber device allows you with the controller to put in any frequency you'd like to affect the brain. And I think we're just only beginning to really see what the kind of research and data that come out from using frequencies to treat various brain disorders. Thank you for your time today. Take care and have a great week.